Inclusion of Students with Autism in the Primary School Classroom by Tara Doyle. The purpose of this presentation is to outline why the inclusion of students diagnosed with an Autism Spectrum Disorder, or ASD, in the inclusive primary school classroom is a critical issue within mainstream education. I will begin by defining autism spectrum disorder and presenting the issues students diagnosed face within their education, as well as exploring why classroom management of these students is a critical issue. I will then identify strategies that can be implemented within the classroom to cater for students diagnosed with an autism spectrum disorder. The American Psychiatric Association defines autism as a complex developmental disorder that can cause problems with thinking, feeling, language, and the ability to relate to others. It is a neurological disorder, which means it affects the functioning of the brain. The effects of autism and the severity of symptoms are different in each person. Whilst autism differs between each individual and the range of abilities, severity of symptoms, and different characteristics changes from individual to individual, the characteristics of an autism spectrum disorder can be broken down into communication problems, including difficulty using or understanding language. Some children with autism will focus their attention and conversation on few topic areas. Some have very limited speech, and some will frequently repeat phrases. Difficulty relating to people, things, and events, including trouble with social interacting with people, difficulty reading and expressing facial expressions, and not making eye contact. Repeat body movements or behaviours such as hand flapping, clapping, or repeating sounds. Many children with autism are attentive to routines and sameness and have difficulty adjusting to unfamiliar surroundings or changes in routine. Children with ASD can also experience sensory integration dysfunction. ASD in the educational setting. Larrabee explores the idea that poor teacher-student relationships are a critical factor when it comes to a student's poor academic performance. Teachers report having difficulties understanding and managing children with autism spectrum disorder within the classroom due to impaired organisational and time management skills, a lack of social and emotional skills, the narrow interest in a particular subject, as well as behavioural issues such as repetitive disruptive behaviour due to emotional outbursts and difficulty in managing sensory integration dysfunction. This results in poorer teacher-student relationships, and teachers find it difficult to manage an autistic child within both the curriculum and tailoring the learning to the individual, as well as within social environments. This leads to a poor sense of belonging, often felt by the student with the ASD. This, paired with a social development level lower than that of their peers, provides a negative social environment for the child and doesn't provide the student with equal opportunity within their education. Policies in place. The Australian Disability Policy Framework Act of 1992 states that every child has the right to inclusive education, but this was not, and for some educational institutions, is still not followed. Many educational institutions will often suggest a child with severe ASD be enrolled at a different institution on the grounds that the school does not have the resources to accommodate the child's needs. This loophole within the policy does not allow for every child's right to an inclusive education. Under the Disability Act of 1992, the Disability Standards for Education was formulated in 2005. It focuses on children with disabilities and their enrolment within educational institutions, student support and resources, the curriculum, student participation, as well as harassment of those with a disability within the education system. The standards require schools to offer all students an education on the same basis as their peers and to make reasonable adjustments to enable students with disabilities to participate in inclusive education. Reasonable adjustments can be made across planning, teaching, curriculum, learning, assessment tasks, resources provided, as well as the environment and infrastructure of the educational institution. It is these reasonable adjustments that must be reported to the nationally consistent collection of data for students with disability that allow for teachers to make adjustments to provide every child with an equal opportunity within education. Resources and funding. Whilst the teacher will feel a strain upon taking the time to understand the student with autism spectrum disorder and tailoring the curriculum to the individual, there are resources available to aid the teacher in managing the student with ASD within the classroom. A child with ASD, depending on the severity, requires individualised tailored learning to suit the child's needs. An aid is a useful resource within the classroom as they can spend the time working individually with the child and can implement an individual education plan and help to tailor instruction or differentiate tasks to suit the individual student. However, funding for resources such as aids within the classroom requires the student to meet multiple criteria that prove their intellectual disability, which unfortunately some students, especially those with high functioning autism, that is with a normal or above average IQ, do not meet. It is this process of fitting a certain criteria that is difficult to set, as every case of ASD is different between individuals. The procedures for applying for funding are difficult and a child can only be tested once every 2 years. This results in a student not receiving the adequate support needed to provide them with an equal opportunity within their education. It is through this lack of resources provided, such as an aid for the appropriate time, whether the child is provided with a full-time aid or funded for a few hours per week, or in some cases not funded at all. This can lead to a strain upon the teachers as they tailor the curriculum to the individual, as well as manage the child's social and emotional needs within their time in the classroom too. Strategies within the classroom. There are two main areas of concern when educating students with autism spectrum disorder: cognitive and social development. ALS states that many students diagnosed with ASD will have difficulty staying on task and can often become distracted easily. This is due to poor time management and organisational skills. To accommodate for this in the inclusive classroom, it is best for the educator to give the ASD student brief, clear and precise instructions to allow for minimal distraction. The educator can have a distraction-free zone within the learning space without any visual aids, too much light, and somewhat away from the rest of the learning. If the ASD student is struggling with distractions, they can be brought back to task through this area. This area would also be useful if the student were ever to experience sensory integration dysfunction. Students with ASD often have a vested interest in a particular topic. If possible, as an educator, it can be beneficial to incorporate this interest into the curriculum. It can even keep the ASD student interested and on task. If possible, it is also a social bonding exercise for the student to teach the class about this topic. This allows for the student to stay on task and enjoy the learning experience, but it also allows classmates who will often see the ASD student, as quoted in ALS, eccentric and peculiar, to see the student in a similar situation to how they would act themselves, and creates a bonding experience. The impairment in social interaction skills that a student with ASD will show. The impaired use of non-verbal behaviour, such as facial expressions and body language, might make classmates feel uncomfortable. This, combined with the lower developmental level than that of their peers, can result in the ASD student becoming reclusive, and the educator will need to dedicate times to create bonds with other students to make the ASD student feel included and gain an equal sense of enjoyment in their education. The buddy system of pairing the ASD student with another student has positive results. The student with autism spectrum disorder will learn social and interactive and behavioural skills from their peer, and often the student will have a sense of enjoyment with helping the ASD student both inside and outside the classroom. Bordeaux's theory explains that an individual's prior experience shapes that individual's thoughts and actions. A teacher that has not experienced or gained a diverse cultural understanding of a student diagnosed with autism spectrum disorder may well find it difficult to understand the social, cognitive, and emotional needs of the student, as well as the disorder the student suffers. This lack of understanding leads the teacher to make assumptions based on their own cultural and social beliefs, which Bordeaux refers to as habitus. It is this lack of understanding that could place further strain on the student-teacher relationship and lead to the teacher neglecting the student's needs that really need to be tailored towards the individual. An individual can change their own habitus, and a teacher would need to challenge their own social and cultural beliefs to change their outlook on the student diagnosed with an ASD. It is through gaining a new perspective and adopting new pedagogical approaches that the teacher can provide the student with an environment suited to their needs, as well as tailored learning to provide equal opportunity for the student. Personal reflection. As a future educator, I am fortunate to have gained a deeper social and cultural understanding of those diagnosed with a disability and the implications each individual faces within their inclusive education. It is through the study of special needs within the education that I have gained an aspect of the implication faced both by myself as a future educator and those within my future classrooms. I think that in order for a teacher to change their habitus, as referred to in Bordeaux's theory, that all teachers, both pre-service and current, should undertake study to gain both an understanding of how special needs implicates one's education, as well as to research pedagogical strategies to better cater for every child's individual needs. I refer to the social model that describes disability as a social construct imposed on impairments by society, as this model addresses the evolution of society to decrease environmental limitations placed on those with a disability and to increase every individual's understanding of those with a disability. A teacher following this model would see a student's ineffectiveness within their education as a result of factors within the environment, lesson planning or direction, and structure, or that of the teacher's own fault to be rectified. As Marsh, Clark, and Pittaway state, it is essential for a teacher to keep reflecting on and improving their practice to remain effective. I believe through reflection on pedagogical practice and through understanding the individual's needs and tailoring practice to suit, that a teacher can be effective in providing an equal opportunity to education to a student with a disability such as Autism Spectrum Disorder. These are my references.